Your child deserves the best, and at Penn State Health Children's Hospital, we provide vital health care to all children, from minor procedures to complex surgeries and pediatric cancer treatment. Our Children's Hospital in Hershey is dedicated to meet the needs of young patients throughout Central PA and beyond. We prioritize creating a positive and comfortable environment for children and families, understanding that hospitalization can be a stressful experience, but at Penn State Health, your family's story is our purpose. Our special Your Kids' Health Matters starts right now. At Penn State Health Children's Hospital and Penn State College of Medicine, physicians and researchers in pediatrics are dedicated to improving lives through expert care and research. We are the only children's hospital between Pittsburgh and Philadelphia fully equipped to treat the most severe conditions. Good evening, I'm Liz Keptner. State-of-the-art neonatal intensive care units, expert pediatric surgeons, and nationally recognized pediatric cancer treatments are all areas where Penn State Health Children's Hospital excels. To kick things off tonight, we'll take an in-depth look at our recent accomplishments in pediatric cancer. And to do that, Deborah Pinkerton is here in our studio. Hi, Deborah.
Hi, Liz. Did you know that neuroblastoma is the most common cancer in babies and the third most common cancer in children after leukemia and brain cancer? Precision medicine is now changing the way we treat the cancer by offering our kids treatments that not only fight the cancer, but help them thrive. Here's Westin's story.
We went on a family vacation to the cabin, and him and his brother were riding bikes and they collided. A couple days later, he started having some low back pain, and we just, you were in a bike accident, you're okay. We went to the pediatrician and they ended up sending us to get labs and ended up sending us here. Met with Dr. Dan, and he did some scans and tests and came back and told us that he had neuroblastoma.
We met Westin last year, and he came in with really bad bone pain and some very abnormal looking imaging studies. And we worked him up and pretty quickly found out that this was because of neuroblastoma. And based on his age and the extent that it was when we found it, it was metastatic, and we needed to treat him with the highest level of therapy in order to be able to get a cure for him. Neuroblastoma is a cancer that comes from the neural crest, which is cells that typically are part of development, and they are on the sides of the spinal cord. So that's why we often see on the either end of the spinal column, that's where the tumors often start. So sometimes it's in the adrenal gland, sometimes it's in the chest. It looked like Westin's came from the right adrenal gland and spread a little bit in his belly there.
In traditional medical care, we would treat children by the type of cancer they have. And so in general, leukemia or neuroblastoma, and everyone with that type of cancer receives the same care. But we know only a percentage of patients will respond to that treatment, not everyone. In precision medicine, we're trying to understand each child individually and the genomics or the biology of their cancer, what has made their cancer grow, and then what is driving their cancer, and are there medications that are specifically targeted for that child that may be different than another child with the same cancer. But understanding what are the best medicines that will help that child, not only what are the medications that this child might respond to, but what medications will this cancer not respond to and maybe potentially be resistant to. They're still young. They still have a whole lifetime to live. So really important in pediatrics because we want to identify targeted therapies that are more targeted just for the cancer, to leave the rest of the body alone so that they're not having those long-term side effects, so that they can have the right treatment for their cancer now, so that they can not only survive their cancer, but thrive for the rest of their lives.
It brings you peace knowing that they are doing everything they can and looking at all the options and looking at his genetic makeup and how he's going to react to certain medicines and getting the very best for him.
So when we diagnose a child with cancer, it changes everything for that family, and it's a very emotional and challenging time for the family. So we do try and explain precision medicine as we're explaining that this is the diagnosis, this is how we're going to treat your child's cancer, but then we're able to tell the families, but we want to understand your child as best we can so that we can know exactly why this cancer happened potentially, what are the important genetic changes in that cancer, and is there anything better that we can do to make sure that your child not only is cured, but does not relapse from this cancer.
I can't wrap my head around what they're researching and doing. She took us in the one room and showed us his neuroblastoma cells under a microscope, and just the fact that they know different cancer looks, neuroblastoma looks like this and leukemia looks like this, and knowing what using the different medications on those cells to see how they react is just so fascinating and exciting.
So it's a lot of explaining new terminology to the families, talking about diagnostic tests that they're going to have to go through, treatments, and what the time frame is going to look like in the short, medium, and long term. It's a lot to adjust to, but families like Westin's are amazing. They've just gotten him through so much, and he's done really well. We're really proud of him.
It has been wonderful working with Penn State. It's great. We actually went to another hospital and we said how much we missed Hershey, because you walk in, all the nurses at the desk, all the staff at the desk know your name. They say hi. All the nurses, we've had all the nurses. We know them, they know us.
This is such a vulnerable time for the patients and their families because they're getting such a devastating diagnosis. And you really need the expertise of some of this team that works together, from doctors, nurses, social workers, music therapists, everyone. We're all dedicated to taking care of these kids. And he just needs to continue following the course, and we're going to continue to follow him into adulthood.
Because of the research of my last 20 years, I've seen that change. I've seen kids where we used to tell them they had a 30% chance of survival. Now it's over a 70% chance. We are seeing kids live, and we're able to cure cancer because of the research, because of the caring and the fundraising and the community coming together. The support from Four Diamonds is really making this happen here at Penn State. The children treated here have the best outcomes possible. And because of Four Diamonds, we're able to do that. I love the theme from this year, A Home for Hope. That's what this money brings. This money brings hope to all of these children, to all of us who are caring for those children. It brings us hope that we are going to do better and that it's going to get better.
Just so grateful. Just all the work that Dr. Sholler has done and all the advancements that she and all of her colleagues have made. It's just amazing, and I'm just very thankful for that.
What an amazing journey, and the advancements are continuing as the team continues to find better ways to treat kids every single day. And precision medicine is just that, precise medical care for the individual. And that's really the true definition of personalized medicine. Back to you, Liz.
All right, thank you, Deborah. We wanted to follow up on Westin's case, and joining us here now is Dr. Dan McKeone, pediatric oncologist and hematologist with Penn State Health Children's Hospital. Dr. McKeone, or I should call you Dr. Dan, right? Everyone calls you Dr. Dan. Tell us, how do you help parents process and cope with the shock of, hearing about a cancer diagnosis with their child?
Yeah, well, it's hard to imagine more devastating news for a parent to hear than your child has cancer. Our job is to be with them, to take our time and answer all of their questions. What I try to emphasize is that at least we now have an explanation for your child's symptoms, and at Penn State we have the expertise and the resources to be with them through their whole cancer journey.
And how do you, create a personalized treatment, that fits both the medical needs and also the family's needs?
Yes, so once we have a diagnosis, we're going to see if there's any open clinical trials that the patient might be eligible for. We've gotten so far in the treatment of childhood cancer because we're not complacent. We're always asking what's the best next thing, and we will offer a clinical trial or standard of care. It's a lot of factors that go into that decision, and our job is to provide the information for the parents to make the best decision for their child.
And it really takes a village, doesn't it? I mean, it's an entire, care team, nurses, social workers, others in supporting the families through this treatment, isn't it?
Yeah, I always emphasize that cancer treatment takes an entire team. You just have to ask one of our families, like Westin's, how much his nurse Melissa, his social work Aubrey have done to support and educate him every step of the way.
How are clinical trials and precision medicine changing the future of pediatric cancer?
So I like to think about where we're going to be in the distant future. We'd love to get to the point where we can take a piece of tumor, put it in a special instrument, and it tells us the exact right medicines to use. We're not quite there yet, but precision medicine is taking us a lot further along the way. We're able to replace conventional chemotherapy with targeted agents that can reduce the side effects and get the best possible treatment outcomes.
So everyone's heard of Penn State's Thon, right? Everyone knows about Thon. The money goes to 4 Diamonds, and that supports critical support to families, and it helps fund research at Penn State Health Children's Hospital. Talk a little bit more about that.
Sure. So 4 Diamonds helps us in 3 main ways. The first is it supports our research endeavors through the Penn State College of Medicine. We have world-renowned scientists who are working hard to figure out the underlying mechanisms that drive cancer so we can develop the better treatments that we need. The second is it supports our clinical staff. Because of 4 Diamonds, we have so many resources we can offer patients and their families, including nurse and pharmacy specialists, art and music therapists. We have a chaplain, a psychologist, dietitians, child life specialists. We even have a therapy dog. And so it takes that whole team to really care for the whole child with cancer.
And what are some future advancements in pediatric cancer care and research? What are you most hopeful about right now?
Right, so we've gotten so good at treating certain types of cancers that we're asking now, not what do we add, but what can we potentially reduce so that we don't expose these kids to the short and long-term side effects of their treatments. And that's ultimately, the most important thing.
Dr. McKeone, or Dr. Dan, I should say, thank you so much for joining us tonight. And we're going to send things back over to Deborah, who is with one of our pediatricians. Hi, Deborah.
Hi, Liz. Thank you so much. Joining us right now is Dr. Amy Zisa, pediatrician with Penn State Health, all about children. So we have a number of frequently asked questions, and we're going to just sort of run through them, and you can provide some of the answers for us. The first question is, how do we know if a child's fever is serious enough to call the doctor or go to the ER?
So this is a really common question that we get asked a lot, and fever is something that can make parents very alarmed. So most times it's very good information for us to know how high the fever gets, but it's much more important to know how the child is acting while they have the fever. If they're able to drink, they're staying hydrated, they're active, they're playful, then sometimes allowing a little bit of fever can actually help to treat the underlying condition that's going on, the infection. If they're very, very tired, they're not drinking well, then they can take some medicine to help reduce that fever. There are 2 exceptions though with emergencies and fevers: newborns, so any child that's up to about 2 months of age, and children who are unvaccinated. You need to speak to your doctor if your child has a fever right away.
Certainly some good advice. Let's talk about vaccinations, measles vaccinations. Why should we vaccinate against measles, and when should my child really receive it?
So measles is a very, very highly contagious respiratory virus, and the only safe and effective way to prevent measles infection is with the MMR vaccine, which contains the measles component. We usually start giving that at age 12 months and then follow that up with a second dose at age 4 months. There are some exceptions to that rule. If you're going to be at a high-risk area and you have an infant that's above 6 months old, they're eligible to get an extra dose of the vaccine, but that's on a case-by-case basis right now. I think as we see things play out, we may have different recommendations, but currently we're still 12 months and 4 years old, and that's the best way to prevent measles.
Here's a very common question. Kids can be picky eaters, we know that. So how can we get them to eat, and what are some strategies to really help parents?
So babies are naturally curious eaters, and a lot of times we'll have parents say that my baby was such a great eater and then they became a toddler and became so picky. One of the best things that you can do is to model good behaviors for your child, so either eating healthy foods in front of them, offering them healthy choices, and then when they're going through that picky phase that most toddlers will go through, continuing to offer nutritious foods and allowing them to have opinions about it, but still continuing to demonstrate good behavior. And don't become a short order cook. Please do not just bend to their whim and offer pizza and chicken nuggets and French fries because that's the only thing they'll eat. Eventually you can actually start to get them to try the foods that they were eating when they were a little bit younger, and then also they can, if they're afraid of foods, you can play games. So just smelling or tapping it on your tongue or taking a very tiny bite and giving positive reinforcement for any positive interaction with the food.
Okay, that is wonderful advice. We are going to be checking back with you a little bit later in this show, and we will send it back over to you, Liz.
Welcome back to our Penn State Health special, Your Kids' Health Matters. I'm Liz Keptner. Our next patient story begins at Penn State Health Children's Hospital at the state-of-the-art NICU. Let's send things back over to Deborah.
Thank you, Liz. We are going to meet a young patient who began his stay at Penn State Health Children's Hospital much earlier than expected. Here's Waylon's story.
So when we got pregnant with this one, it was different and it felt different. And I kept going to appointments saying I'm having issues like bleeding and things like that. And then we had our 20-week ultrasound at 18 weeks. And it was at that appointment that they noticed that my cervix was opening. And it wasn't like, oh, you're having this baby. It's kind of like, we need to watch this. But I was bleeding and a lot. So they're like, we can't tell what's happening. So we need to cut the cerclage. And when they cut it, I immediately went to 7 centimeters.
The nurses and the staff and the doctors that came in to talk to us prior to delivery, that there was a large risk with him being born so early.
It's a challenge because those types of babies are fragile. And we know that there's unique aspects to their physiology being born at such an early age that we have to be cognizant of and really, really pay attention to so many minor details. Growth is obviously the most important thing. And so there's many things that we do to optimize that, because when you're no longer inside of mom, there's many stresses put on the body that make it more difficult to do that. The NICU is a roller coaster. All of our families will tell you that. But in Waylon's case, his family just was so strong, so resilient, so engaged.
Waylon was born, he was 1 pound, 12 ounces, 13 inches. Originally when he was born, I tried to sit up to see him and couldn't. So they actually brought a picture down, but I don't think it really hit me what he exactly looked like until I was released to come up to the NICU. And I think it was shock. His skin was kind of translucent still. It was really incredible to see.
In the beginning, he was one of our more critical kids, and he required a lot of eyes on him, a lot of hands-on care.
Basically, the nurses and the staff did a great job of making us feel at home. They did a great job of caring for my son. They did a great job of caring for my older son, who would come into the room and want to play and want to just be a little kid.
Their lungs are not fully developed, and they won't be for some time. So for many weeks and sometimes months, they'll require extra support to their breathing. And that's critical, because without that extra support, it's going to be very hard for them to also grow. So that was certainly the case with Waylon. He did need help with breathing for a number of weeks. Certainly we gave him the most optimized nutrition possible. Mom was able to provide milk, and we obviously keep temperatures stable within a good range in devices like the one that you're seeing in the incubator. So there's a very careful balance to all of those things, the nutrition, the electrolytes, the breathing, everything kind of has to be considered carefully every day, multiple times a day, to ensure that our babies have the best outcomes.
So when we look at a level 4 NICU, which is the highest level NICU, they take care of the sickest children. They're relying upon some of the other NICUs in the area, the level 3 and level 2 NICUs, to help care for those children. And so the fact that we have an outstanding system where when a child is extremely ill, they need to come here and we can take great care of them. But then once they're stable, once they're getting better, many times we can actually talk about sending them back home closer to their house at a NICU. Because again, we have a great catchment area, we have a very large area that we receive children from. But an hour or 2 hours a day is a long time for many families to travel. So the fact that we have exceptional NICUs elsewhere allows us to maybe get them back closer to home at an earlier date, so it's less stressful on the family.
Several years ago, decades ago, people weren't really sure if babies born at 24 weeks could do as well as he has. And now we're seeing babies even younger. We have patients born here who are only 22 weeks at the time of delivery, and they are thriving, and they are meeting their milestones and growing and developing. So the chance to be a part of that is extremely rewarding.
I keep in contact with a lot of the children that I've operated on. I can remember many of those children, even 10 or 15 years ago, that we met on the first day of their life.
Penn State Health Children's Hospital is so special. We take care of our babies when they're so tiny, and we see those glimpses of how resilient they are, even then. But to see him now thriving and so happy and to see how he's just flourishing developmentally, it's absolutely incredible.
We have kids that have been here for months and months and months, and their family is seeing you sometimes every shift 3 times a week for 12 hours straight, and you really end up being a part of their family, and you kind of feel like they're part of yours.
I remember a nurse taking my older son and parading him around the hall, almost like it was her own. And that was just a huge help. There's just so many times where they just cared for all of us well.
Thanks for loving my boy and checking on him, and even when you weren't his nurse that day, just saying, you know, I just wanted to come in and check on Waylon today. So it's those small things that really made you feel special and seen and not just another number.
Oh, what a wonderful journey. Waylon is doing very well, and this really reminds us why people from all across the region come to Penn State Health Children's Hospital. They're looking for expert care. Back to you, Liz.
All right, thank you, Deborah. We're joined now by Haley Kryder, perinatal high-risk nurse coordinator with Penn State Health St. Joseph Medical Center, and Dr. Jaimey Pauli, chief of the Division of Maternal Fetal Medicine with Penn State Health. Thank you both so much for joining us. We're going to start with you, Haley. What types of conditions or complications lead you to refer a patient to Penn State Health Children's Hospital in Hershey for a high-risk pregnancy?
So there are a few different reasons or complications. Usually once it's determined that the pregnancy is too high risk to handle at St. Joseph's, that decision is made to move the care over to Hershey so that the patient has access to all the specialists there that are needed, whether it be a reason that is related to mom or a reason related to baby. They are able to provide that higher level of care for our patients.
And Dr. Pauli, can you walk us through what happens when you work together on a high-risk case? You know, what is the process like for mom, and how do you help prepare her for the next steps?
Absolutely. So really the first thing is the patient is identified as high risk and is referred to us either from our colleagues at St. Joseph's or through our complex fetal care center if it's a baby issue. And then the patient sees maternal fetal medicine, and then also will often follow with our high-risk complex fetal care nurses to help get them to the pediatric providers that they will need to meet to prepare for the baby's arrival, whether that's NICU, pediatric surgery, or cardiology. And then after that, we continue their prenatal care in collaboration with our colleagues at St. Joe's, and then plan their delivery.
Okay, lots of collaboration. Haley, how do you and the team, stay in close communication with Dr. Pauli's team to make sure that each patient has a seamless experience in her pregnancy?
Yeah, so communication is obviously extremely important. Dr. Pauli's team is wonderful in helping our St. Joe's OB-GYN team with these pregnant patients with their high-risk pregnancies. We usually try to include them in the conversation early just so that we can get the referrals and the recommendations that they have to offer. And then each month we host an interdisciplinary meeting that involves all of the colleagues out at St. Joe's as well as Hershey so that we're able to discuss our high-risk patients with everyone involved and make sure we're all on the same page with their care.
That's great. And Dr. Pauli, why is it so important for women with high-risk pregnancies to deliver in a place with an advanced NICU ready to step in?
So when a patient has a complicated pregnancy, there are a lot of unknowns. We know a lot of things from ultrasound, we know a lot of things from tests, but there are still a lot of unknowns, and you don't always know what's going to happen at the time of delivery. So it's really important that we have the pediatricians and the NICU staff available immediately to care for that baby from the second that he or she is born to make sure that that transition goes smoothly and safely.
Okay, and one more question. What makes the NICU at Penn State Health Children's Hospital, uniquely equipped to care for these medically complex cases?
Well, I mean, first of all, we're the only level 4 NICU in the entire region. That means we have the highest level care, the most advanced specialists, and all of the subspecialists that are needed to help support babies with a number of medical and surgical issues.
All right, thank you so much. Haley Kryder, perinatal high-risk nurse coordinator with Penn State Health St. Joseph Medical Center, and Dr. Pauli, thank you so much for joining us today, and we're going to send things back over to Deborah. She's, again, with our pediatrician.
And thank you, Liz. Joining us, as you had mentioned, Dr. Amy Zisa, pediatrician with Penn State Health, all about children. So this is a question that has come in. You had mentioned that you do have this practice and you have availability. Why don't you talk to us about your practice and how people can find out more information?
Sure. We're located in West Reading. We've been there for approximately the past 25 years, and we've been part of the Penn State family for about 6 years now. We have 7 pediatricians, 2 nurse practitioners, a physician assistant, wonderful nurses, and excellent support staff. And you can reach us at 610-372-9222.
Okay, that's great information. Now, here is a question that we have. Let's talk about screen time, because that is so important. How much time should we really allow our kids to be on a screen, and what should we really do as far as protecting them about things online?
Yeah, I think this is probably one of the most important topics, and we're starting to learn a lot more about it. So the American Academy of Pediatrics recommends no screen time for children under the age of 2, but instead having lots of face-to-face time and face-to-face interactions with them. Then
that sounds about right.
Yeah, then limiting 2 hours per day above the age of 2, and then monitoring every single piece of content that comes your child's way, 100%. And that also means locking down chats, because we teach our children traditionally, we don't talk to strangers in person, but now we don't talk to strangers online. If you don't know that person in person, then you shouldn't be chatting with them online, because that's how we can have a lot of risk come our way.
Yeah, we certainly have to protect our kids. Here's another question. What's the best way to support my child's mental health, especially with all the stress kids have? I mean, kids are under so much stress these days.
A ton of stress. We're seeing a lot more anxiety and depression in children and teenagers, and we think that that has a lot to do with social media and the changing electronic environment that kids are in. So number one is building a good self-esteem. So talking to your child about how to stay positive, talking to them about what they like about themselves, really trying to build up the things that they're good at. Number two is working on coping skills, healthy coping skills, exercise, having activities outside of spending time on your phone or video games. And then, if you're having difficulty and you notice that there's a mental health issue or you have a concern, reaching out to help either through the school, your child's pediatrician, or mental health services.
Yeah, lots of great advice tonight, Dr. Zisa. Thanks so much for being with us.
My pleasure.
And we'll send it back over to you, Liz.
All right, thank you, Deborah. That's going to do it for us tonight. As always, you can find the latest information on our website, pennstatehealth.org/children's. We also want to remind you that if you're experiencing symptoms that require medical care, please don't wait. Reach out to one of our experts now to get an appointment scheduled. Because at Penn State Health Children's Hospital, your kids' health matters. Good night.